I have to start by saying, Gary, you insist on people calling you by your first name, and yet, in addition to being executive director of the Hackett Center for Mental Health, you've published more than 75 articles, you've written 9 books, you're nationally recognized as the founder of the Building Bridges initiative. But we know from our work with you that that personable approach towards people is really your preferred work culture. And so I wanted to start by asking you, what kind of influence does company culture and values have on employee mental health?
Well, first of all, thank you for having me join you today. And I totally agree with you. In terms of company culture is really critical in terms of how people feel about their mental health and whether or not that they are able to share information. And obviously, that our concern is that most folks. I mean, there's a lot of issues around mental health in the country, and that will impact the workforce, and it impacts the ability for people to perform and function effectively. So, I really believe that that workforce and work culture, that it's all impacted by a management style. And for me, I believe that accessible managers create more of an open environment, and that positive affirmation improves the employee health and employee performance. The idea here is that being able to talk openly about mental health within your employment setting, and literally say that it's okay to say that I'm having a challenge, will actually allow people to get more support and help and go a long way towards improving morale and performance than if people are bottling it up or hiding it. And so we don't want employees to feel unsupported. And the whole idea of a safe environment, and a workforce, a workplace culture that allows for this kind of accessibility really does improve the people's performance and productivity, which really can help you with both recruitment and retention issues for your employment.
Yeah, and thinking about that, to me, it seems too that it encourages a formation of relationships within that work environment too, as opposed to, say, silos of structure and titles and things like that, which I would think also lends itself to more easy expression that relates to also well-being of employee mental health.
Well, I mean, for me, certainly, in various forums, I'm referred to as Dr. Blau, but I also feel that by really pushing on this idea, call me Gary, that kind of informality levels the playing field for so many people. I mean,
yes.
Whether you're a junior employee, and that it removes some of the hierarchical kinds of things that are more, typical in employment settings, and it sets a standard, for how we respect each other. Businesses are very interested right now, more than ever, really, not just even with COVID, even prior to COVID, in improving the mental health of their workforce. And they understand that, that there are good data demonstrating that mental illnesses can be costly. People that are out for reasons of anxiety or depression, or having family members, that those sort of things are not good for business. And so they understand that if they address mental health as a healthcare issue, that they are going to improve their, the mental wellness of their workforce. As I said before, they can improve their recruitment efforts and retain more people because they feel more positive, or they feel more supported. They get greater productivity out of their employees, and helping businesses think about the kinds of benefits that will help their employees is really the hallmark of our Path Forward initiative. The Path Forward initiative is something that the Meadows Mental Health Policy Institute, which is the parent organization to the Hackett Center, along with the American Psychiatric Association and its foundation, and the National Alliance for Healthcare Purchasing Associations, have come together to talk about all the ways that businesses can literally improve the way that they contract for mental health benefit packages. So our goal through the Path Forward is to help businesses, and here in Houston with the great assistance and the spearheading by the Houston Business Coalition on Health, is to look at their benefit packages, see what they're currently contracting for, and make sure that those kinds of services have an evidence base and are the right ones for their employees. Because ultimately, it's about getting employees the kind of services that they need in order to do a better job. And that really helps everyone.
Right, and the wonderful thing as a regional center of the Meadows Mental Health Policy Institute is that the Hackett Center provides that concrete data that doesn't just say, this is a nice idea or this is a good idea. This has substantiated benefit. And I think that makes a big difference, perhaps especially in the business community, in having those conversations.
It does. I'll jump in and say, in addition, that many employers are going down, this path. They have seen the importance of addressing mental health. I think now they're seeing it, more than ever. As we know, there was a recent study through Kaiser Foundation that, talked about almost 50% of Americans right now are actually concerned about their mental health as a result of the COVID-19 pandemic. And business recognizes that this is important beyond the traditional ways. Many folks will do really important work around, creating their employee assistance programs or having, flyers out about how to, get services. This actually goes a little bit further than that by making sure that the benefits that are being contracted for and made available to employees have the evidence base necessary, to make a difference. So whether it's anxiety issues, depression issues, that we can bring to bear really good interventions that will impact the functioning and improve functioning, and that's what I think we're all interested in right now. So we really are continuing our efforts to bring mental health into a greater public awareness, to connect it with the idea that it is part of our overall health, and to make sure that folks know that it is okay to say when you need assistance.
And to circle back to where this conversation started with regard to the influence of company culture on employee mental health, having that okay to say component of company culture is going to be very important, and perhaps we'll have achieved a whole new level of appreciation having gone through this pandemic era.
I agree. When employees feel overwhelmed or unsupported, they just don't do their best job. They don't perform as well. Just the same as any other physical health kind of an ailment. If you have diabetes or you're struggling with cancer or respiratory issues, we know from the data that there are significant correlations between one's physical health and mental health. People that have physical health issues like cancer or diabetes are much more likely to be depressed, and vice versa. Folks that have a major depressive disorder are more likely to have coronary artery disease or cardiovascular issues. So we have to keep pushing on this idea that the mind and body are connected, and that mental health has to be a critical component to overall health.
Yes, they're not two components. They are intertwined.
Yes.
Well, thank you so much, Gary. I really appreciate the information. Good luck continuing your forging ahead with the business community. And we'll include the URL to the Hackett Center. So should someone have any questions about getting more information, they'll have a way to get in touch with you.